Hello, everyone. Do you know what? It's great. It's great doing something in the north, home in Leeds. So I've just travelled 4 miles. Last night I was at a digital catapult event led by Digital Health London. We saw 5, 6 fellows and solutions and innovations, and I actually have done some calculations. I got here late, but I did some calculations on all what you guys said could save the NHS and what they said they could save the NHS, and I think we've just found £4 billion. So, it's absolutely amazing. Before I get on to my speech, it's quite interesting to listen to what you guys were saying. Some really, really interesting things there. Couple of comments I'd make before I get into my more official bit. There are some great stuff going there. I do think sometimes you need to reframe the messages on the people that you're speaking to. It's really, really clear that there's some great solutions that can make positive impacts right now, here and now. And there's a reason why we always pull over or you stop when you need to change a tyre. And I think what we're trying to do with the NHS is we're trying to change a main engine on an aeroplane that is flying at 500 miles an hour. You know, we've got major challenges of just delivering. What would be great if we could stop people being ill for a couple of months, sort everything out, implement all these solutions, be careful with the apps. I think in the last 2 months, just the apps I've seen, some patients will have 472 apps on their phone, so that are all separate. So, you know, it's a really, really difficult challenge. But one thing I've started looking at, and I'll go into a bit of me in a second. You know, this amazing institution was created in 1948, and we're sort of delivering it now as though we're in 1952. So, if someone said to you to recreate and design and build the NHS, I don't think we'd do what we're doing right now. And it's a really interesting scenario of all what's happening, all what's available. Me personally, I know I look really young, but I've been working since man and boy. Northerner as well, so, you know, cobbled streets, all that sort of good stuff, flat caps, whip it. 27 years I've been working. I started in health, would you believe, IT health. So I was one of the first programmers that created or helped design and build a product that became called EMIS in GP land, the 17th member of staff of that organisation. So way back when we were delivering IT solutions back then, digital IT solutions on these amazing computers that sort of filled this room and didn't do very much. And then over the years I've progressed, left health and went in to see a number of other industries, mainly banking, and actually watched the influx of technology really take part in banking. My speciality in banking, as though it was IT, was fraud, you could probably tell. And I can still remember the days when we were having the conversations where we said, nobody is going to bank online through a mobile phone and the internet. Just not going to happen. Don't know what we're wasting our time for. Let's make some really nice, pretty banks that everyone can walk into. And queue between 12 and 2, Monday to Friday, which was peak traffic. And then we realised in that queue between 12 and 2, less than 5% actually needed to speak to someone. So it was, can I have a bank balance? Can I transfer this money? Can I pay this bank, etc. And lo and behold, that's how we started to channel shift and change the model in which we bank today. So when was the last time you went to a nice branch? Anybody been in the last week? Thought not. Yeah? So I've not been to a bank for a long time. Interestingly, because I used to work for one of the big banks, I'm still a pilot user. And now I'm even able to take pictures of a cheque and send it through. So there is no need for me to ever to walk into a bank. Speaking to someone's great. Health's very different. Let's not forget that. So anyway, yeah, enough of me diatribing on. Let me talk about what I want you to talk about today. So I'm Cleveland Henry. I'm from NHS Digital. Yes, absolute grand title. Probably one of the, I'd say one of the best jobs in the organisation. So I have a day job. So my day job is I lead what is you guys will all know it by NHS Mail. So I'm responsible for that, whether you love it or hate it. And I am currently focusing on the replacement of what I'm calling, or what we are calling, digital collaboration. So that's looking wider than just email, but actually looking at some of the capabilities that people are shouting for around improving collaboration capability. So that's my day job. Outside of that, I get to come to sessions like this. I get to meet a whole host of organisations, systems, solutions, and the rest. And that's a really, really good thing. I'm seeing some amazing things. And, part of seeing all these things is really trying to bring back to the centre, the ivory tower that is Bridgewater Place, which is my building in Leeds City Centre, is to actually talk to the guys and girls that are delivering and looking to deliver a lot of the wider technology solutions, but really seeing how we can oil the wheels to allow these solutions to come to fruition. So really trying to get that movement, or as sometimes we call it, diffusion, in getting that entry and that adoption, that there's some really good stuff going on and that it can be adopted and used and grows. I think the big challenge for me at the moment is there's so much of it. There is significant amount of great stuff being undertaken right now, and it's trying to, I suppose, get through the cloud of all those multiple thousands of solutions and actually get some of those forward. The other thing as well, which is really interesting, so I see across the country some really good adoption. It's really good to hear some stuff going on in Bradford and Leeds and Sheffield. There's stuff going on in London, but we're not really that bothered. But and Alistair will tell you that when I saw Alistair last week and the week before, I said to him, "Get your rear up to the north." It's all right, tell me about East Surrey or whatever. I mean, where is that? But one of the things that is fascinating, I always see, there's some great stuff going on, but it's happening in pockets. So someone adopts and someone saves millions of pounds here, and it's their little thing. And then that solution provider, that innovator, goes and speaks to someone else, and that someone else goes, "Yeah, but it's not invented here, is it? So let's find my own, or someone that's done it on my doorstep." The Southerners in particular. It's hopefully where NHS Digital going to assist and support, working with the HSNs and the rest to try and really get this explosion and drive it forward. NHS Digital, everyone will know and love us. We are the centre with a huge vision that really talks about harnessing the power of information and technology to improve health and care. That's what we all want to do. And we talk about that in a lot of detail at the moment. NHS Digital delivers a whole host of solutions, guidance, support from the centre. But we can't just do it all ourselves. And, being in partnership and working with the various HSNs, the various innovation groups, etc., around the country and internationally is really key. And that's why I'm here, to listen to all what's going on. I think we're all read, loved, seen, hated, whichever one you want to pick. The 5-year forward view, personalised health and care 2020. I think from my perspective, there's not rocket science in there. It's not brain surgery, actually, we should say, isn't it? We're in health. There's a lot of very obvious items of improvements and guidance and things we should be doing to deliver better health and care. The bit that we focus on in NHS Digital, obviously, is to try and use and make available that data and information to provide and make those solutions go forward. And there's an acknowledgement, a system-wide acknowledgement now that we can't just continue to work as we always done. A major transformation has to take place, and data and information is key to that, and we believe that will help deliver better care and services, both online, digitally, and the rest. And quite frankly, the public expects it now, and we've got to get with the programme, so to speak. It's always one I always look back at and say, health innovation, nothing new. We've been doing it a while. We celebrate the 70th birthday. I think it's this July, the 3rd, I think it is. So look forward to lots of parties and the rest taking place. We'll show them. I suppose what I'm trying to say in here is that innovation is nothing new. We've been doing it since 1948, and we're doing it now. I need to upgrade my slides, though, or we're in a new year. I keep forgetting about that. Moving from the things that we've done, the heart and lung machines, GP records. I can remember when I was a programmer back then and doing some data transfers, and we'd have crates of George Lloyd file folders and transferring data online. I'm sure there's some practices still doing the same, but we have significantly moved on, and a lot of the things have now just become the norm in the way we operate, the way we deliver service. Listening to you guys, no, you weren't mourners, but when we listen and we talk about some of the things that are really difficult and some of the things that are hard, and we also sometimes have to reflect at some of the amazing things that we do to deliver health and care to the patients and to our family and our friends. I sadly lost my father last summer, and his care in his last 21 days was absolutely amazing. Thank you, Leeds Teaching Hospital. So he had in his last 21 days, he had 10 days in hospital. The care was amazing, even though the staff were hamstrung by moving pieces of paper around and trying to communicate to each other about ensuring that he got appropriate care during those 10 days. And then he went out home to Leeds for his last 11 days. The palliative care service was absolutely amazing. Simple things you may have heard in Leeds, like the Leeds Care Record, really, really helps individuals to have information to hand and to be able to treat with continuity, maintaining dignity and all the rest of it. However, it was still very manual for the individuals, and for us as the family that were going through a very sad period through the end. And even though I was going through that very difficult time, there were just so many things I could think of from a technology and from a digital perspective that could have made a difference, and a positive difference to the carers, providing the amazing care, and to us as the family. Less so my father, because it was all about keeping him comfortable, in his last days, making sure he had a nice rum or a nice whiskey or, whatever he fancied during that sad period. But for me, it was a real kick up the bum to say, what are we going to do to try and improve the care that we're delivering to patients and carers and families? And that for me was a real kick. It's made me rethink the things that we do. And I never stop remembering the absolute care that the individuals provided, from the hospital, from the community, from the hospice and all the rest of it. Hamstrung, we can do it better with technology and digital. It's there for the taking. Back to the case in point. So, I think that is just one example, but we've seen the potential of technology, the potential of innovation and what it can do. And that technology is now accelerating at speeds that are bewildering. I mean, unbelievable speeds. You look back at when we all first started using mobile phones. I still have the same number, actually. I got my first mobile phone in 1992. They've added another digit to make it more difficult to remember, but that's when I got my Nokia brick. In fact, it wasn't the Nokia brick, it was on a little handle back then, and it moved to a Nokia brick, and now moved to, what I have, which is, the best phone in the world, which is actually more powerful. What I have in here is more powerful than the systems we were putting in GP surgeries that ran a patient list of 20,000 patients. Just shows the power that is now in our pockets. So, technology, and someone said earlier about, delivering the technology that is here today, and then tomorrow it's out of date. So that's the speed. And when you're looking at what we're doing from an innovation perspective, what you guys are doing from an innovation perspective, we've got to keep that in. Nobody wants to be the trust, the CCG, that invests £200,000 in a solution, and in 12 months' time, they need to do it again because it's old hat. So, that's what we've got to think about as well. So we need to deliver technology that works today, that delivers to the challenges today, but is also future-proofed. So someone said that, and I was going to kick them because it was on my speech, but there you go, thank you. I suppose getting back to some of the basics as well, despite what you sometimes read and hear, we do deliver back at NHS Digital some state-of-the-art or systems and services that are completely reliant and reliable. And we do it, and we have been doing it in particular in the last few years, better than we ever have done. We've in-housed a number of the services and deliveries that we do, and they support either saving money, delivering information, data, etc. And we constantly do that. And through the paper, the PHC 2020, there's 33 programs, technology programs that are delivering a number of national services. Some of that is also about developing the workforce and creating digital solutions and information, and data being really key. I heard a few people mention data. But I think, and I'll indulge me in sort of talking a bit about my own programme, which was NHS Mail. We did some great stuff with NHS Mail. If you look, we're now in the Guinness Book of Records for actually doing the largest email migration of a single tenancy, as it's called, in the world ever. So, we do some great stuff, and we hit records and the rest. But for me, the value of NHS Mail and services like that is not just about us replacing and creating a new email solution. It's about creating the capability and how it's used. And that's where the value is going to be. I mean, if you look at email, my two daughters, one of them is now 13 going on 26. She tells me that email is dead. Facebook's for old people. That's the sort of things that my children are telling me. And that's why, we've got to do bigger, better, wider. And the stuff I talked about, what I'm doing now, is looking at what is the future solution for NHS Mail or digital collaborations it should be. So when she tells me that email's dead, I daren't tell her that the NHS is still the largest procurer of fax machines in the world. That is a true fact. It really is. It's not just me. So, I think you've all talked about it, and I'll say it as well. I think we need to innovate now. I think we need to innovate. We need to look at simple solutions. We need to look at solutions that are going to make a difference. We need to look at solutions that are going to fix today's problems, tomorrow, and further forward. As I said, I see, and I have the pleasure of seeing so many different things. Sometimes I'm like a giddy kipper, seeing sorry, it's a northern term now. Seeing so many great solutions that are out there. There's something in the back of my mind that almost says there's too many, and that's a real difficult thing to say. And with that, where does it go? So when someone goes into an organisation and shows and gets out their nice, beautiful showcase of the solution, there's probably 4, 5, 6, 7, 8 similar solutions that are also doing the same. So sometimes those frustrations of having to knock that bloody door again to tell them how great your solution is 3 months later is they've often sometimes seen a few more, and or they've got quite a major burning issue that's stopping them from being able to even take on board the most obvious solution that's going to help them. That whole trying to change the engine on the plane while it's still running. So, yes, lots and lots of solutions there. I think we've got some great opportunities by just looking at some of the technology innovations and technology capability that's there, anything such as social, mobile, the cloud, and hopefully you'd have seen our announcement last week or the week before. They all merged into one, to be honest, especially because I've not had a drink yet this month. And predictive analytics, Internet of Things, machine learning, AI, bewildering the things that are out there. And one of the things that I've had, again, luxury, particularly in the last few months, is being able to travel around Europe and seeing what they've been doing in this innovation space. Quite sadly, I think I'm seeing quite a lot of them ahead of us, in particular the Scandi countries, that seem to be embracing innovation and technology at a pace that it's taking us some time to get there. And I've got total faith that we're going to also do the same and start moving on with that. You guys, as I said, have produced some great solutions, and I've seen some of them in action, and I've seen many of them around. I'm loving the patient portals. I'm loving some of the apps that we've got out there. People talk about the 10% diabetes cost of the budget, and 80% of that being avoidable by people taking care of themselves, healthy living, getting all the bank doctors. I mean, it goes on. There are some amazing, amazing solutions. And I think, if we had both the authority and the ability to basically pick every single one of these solutions out there and say to these organisations, just bloody implement it, because this is going to make a massive difference, it would be great. But it's quite interesting how we've gone through a full circle. So everyone, or those of you that have been around for a while, may remember MP Fit. So that was demand from the centre, tell them what they're going to do, we'll develop it, we'll put it in front of you, and you'll use it. And we will select a single or a small amount of solutions to be out there and implemented. That went well, didn't it? And then we switched and we said, right, we can't do that from the centre. What we need to do from the centre is provide the backbone infrastructure to allow these things to happen. And what we'll do is we'll allow everyone to go and do those things properly and do it correctly. And now what we've got is more than 1,000 flowers blooming, some of them blooming very well, others not. And we've got to get the right balance between what should be dictated, if I can call it that, and where we can really drive forward with standards, interoperability. And those of you that mentioned being able to interrupt in certain solutions already really tick a number of my boxes. And really, the people, when we talk about core design, ensuring that it's working with an organisation, solutions that have developed from the ground up with those people that are needing them and using them and know the problems. Us techies, and I used to have long hair and wear sandals, can no longer develop these solutions in little dark offices. We've got to get out there and speak to the users and the customer. Oops, wrong presentation. That was for Booper. To speak to the patients and the carers and the people that are providing those services, so they're there. There's been a lot of commentary around what is going to be next. There's a whole host of commentators that are out there. Watcher being one of them, and if you've not read either Digital Doctor or some of the quotes that he came out with in his review of 2015, it was very, very interesting. He did two things, and one, he talked about the differences between ourselves and the US in how we deliver healthcare and how we focus on health informatics or digital technology, whatever you want to call it, in that space. And there was some real common themes and threads that came out of a lot of the stuff that Robert Watcher did. But what he also did, he sort of looked ahead at the services and the way our patients and carers, etc., are going to be expecting it, and how we need to reimagine how we're going to deliver services, and how can we start ensuring that we're delivering the solutions that are going to work in the future years, and how people, everything from, I talked about the bank thing earlier. My GP surgery are absolutely brilliant. So, they not only do telephone consultations, but they do video consultations, which are great, because I spend half of my time in London and I really haven't got time to take half a day off the office to go and get a quick appointment for a prescription at 11:20 on a Tuesday morning. Just doesn't work. So, really looking at, and I as a patient have varying expectations now in everything I do in my daily life. What can we apply in health, even with all its differences and intricacies? We can do some stuff so much better. So there was a lot of conversations about where it's going to be from an NHS digital perspective. And I talk about future proofing. We've got to work with everyone to create shared platforms, architecture, standard, interoperability, really, really key. Really pushing ahead with confidence and trust and partnerships, and help create that digital culture that is there in some places but needs pushing forward. That will underpin adopting such innovations in 2018, but also in 2020, 2030, and 2040 is the period I look for. I don't look any further than that because I'm not sure I'll still be here. So, we look at it in three sort of areas. I look at anyway from a focus perspective, and I talk about the strategic focus, and that's about the engagement, looking at the pressures affecting the health system today. What can we do? Either providing those systems and solutions, we've seen some of them today, that are going to help today's pressure. Those that are going to not only help today's pressure, but by trying to support, reduce that pressure, it'll give us in health and care a bit more think time to spend more time to look at some of the innovation that is actually going to make even greater differences. So it's really looking at that. So, being able to create that strategic thought, strategic think. Sadly, when I walk out to some trusts and I say to them, have you thought about, some of the solutions that, do you know what, Cleveland? All I can think about is the stuff I'm having to deal with right today. Even though that stuff sounds really great, I can't ignore it. So, create the solutions that create some airtime and deal with some of the pressures. And how from a strategic perspective, what are the effective approaches and partnerships in driving forward with innovation, be it mobile, be it web-based, be it whatever it may be. But what are the appropriate engagements to make that happen? And be it in particular, and I think we've got a great opportunity with patients themselves. I think the second element is technical, and we can get very technical at times, and that technicality includes, building, I think, is really key. Interoperability, making that work, and I don't think, if I could give you my view, we've done that perfectly well up until now. So there's a whole host of systems that have been created and developed that are not very good with interoperability today, and we've got to really try to support work and drive in that direction. And I can see some really good stuff that's out there, and we need to create flexible frameworks and infrastructure that you guys can use and you can tap into, and everything from open source, open data, all that stuff in technical. And then the last sort of bit talks about social, and really getting the culture and the trust right. Really getting and bringing on board the opportunities that we have in engaging with, the patients, the end user, and really driving some consistent themes around trust, and what we can do in that space. The next we're all going to start talking about, we're talking about systems and solutions for today. We've already started talking, you hear people talking about machine learning and AI and blockchain and all these great new themes of future innovation. They all have their potential space. I've seen some really good stuff with machine learning in action, that can assist with, or as Gartner, to use a Gartner term, digital twin is what they call it. So what they do is they run and allow a normal operation to work in its manual fashion, and they're using digital solutions in the background to show the results. And one of the greatest tests I've seen recently is with oncology. And not only just looking at historical data, but also, doing that whole patient like me. So feeding in lots of information, but also being able to look at the pathways based on different outcomes and different choices. So, there's some real great solutions and technology that's coming that we've got to tap into. I think, and the reason why I say, looking a bit of ahead as well from a technology perspective, I think we missed the mobile phone coming. I think, we're now tapping into it from a health perspective and getting onto it, but we missed that real push of what it was coming and what the potential it had. We're now getting there. Without a doubt. So I'm going to come to an end very shortly because I think I've gone over anyway. My sort of viewpoints are, so if we can get the culture right and we can get the trust right, if we can build interoperability, if we can build the infrastructures that we need, if we can start looking forward as well as currently and really look at where the forces are at play. And I think if we can adopt some of this innovation, really look at driving it forward. We also need to get a bit ruthless in some places. And, someone talked about, how many times do you test, how many times do you try? We've got to, one of the things I always say is fail fast. If a solution is just not getting there, just stop, move on, and be comfortable with that. Because actually, we've got the opportunity to really push on, and it's very, very difficult. In particular, if you're a small provider, organisation, you've put a lot of investment of time, money, etc. You just need to make that happen. But you need to sort of own up to yourself as well, to kill it if it's dying anyway. Just do it gracefully. So with that in mind, I just want to say, and I think someone else said it today, let's look and find the solutions, the innovative technology that will enhance positively today's issues and tomorrow's challenges. Let's stop procrastinating. Let's get on with it. The NHS has always innovated, and the opportunity to do even more is there for the taking. Thank you very much.